Good afternoon, everyone, and thanks for choosing Across the Fence. I'm Will Michael, in for Judy Simpson. Today on the program, we feature our occasional series of programs with experts from the Vermont Cancer Center in partnership with the University of Vermont and Fletcher Allen Healthcare. And our focus today is on cancers of the head and neck. Joining me are two experts from the Vermont Cancer Center. It's a pleasure to welcome Dr. Marion Couch and Dr. Steve Grunberg. Dr. Couch is a head and neck surgeon, and Dr. Grunberg specializes in medical oncology, and you are both professors at the University of Vermont College of Medicine. Good afternoon, and thanks for being with us.
Thank you.
Our pleasure.
I think the first question really is, what are we talking about when we hear that phrase head and neck cancers? And I'll start with you, Steve. Is this a group of similar cancers? Is it different illnesses? What does that mean, head and neck cancers?
Well, most of the head and neck cancers are actually very similar. They're all what are called squamous cancers, since they're cancers of the lining tissues. There are a few other ones that you find in the same area. There are lymph nodes, so you can get lymphomas, and some of the salivary gland cancers can also appear and are treated a little differently. But most of what we're dealing with are called squamous cancers. That would include cancers of the mouth, the tongue, the voice box, most of that area.
I guess I want to point out what we're not talking about here is brain cancer.
Right.
What you brought along in one of the slides, stills that you brought, that our director John Melly can put up, shows the regions that you're talking about. And maybe you just again recap for us a little bit about where the area in the head and neck that we're talking about.
Well, as you can see, we've got actually a fairly wide area. It goes from the area around the nose, down through the mouth, the back of the throat, and then further into the neck to get down about as far as the voice box. You get further down than that, you're either into the lungs or the esophagus. But that's pretty much the region we're dealing with. So it literally is the head and neck, except for the brain.
So what do we know about what causes head and neck cancers, and maybe who's most at risk?
The traditional risk factors for head and neck cancer are smoking and drinking. It's been that way for decades, and it still is. So smokers and drinkers are the people that we watch out for. And not just smoking tobacco, actually any exposure to tobacco. So chewing tobacco doesn't make it any better. It just changes the location in the head and neck area where the cancer is going to appear. This is now beginning to change because we're now seeing virally related cancers, particularly the human papilloma virus. And HPV can cause cancers within the mouth itself, usually not in the larynx, the voice box, usually not in the nose or nasopharynx area, but in the mouth. We're tending to see more and more of the HPV-related cancers.
So are both men and women at the same risk here?
They are. With smoking and drinking, it depends on if you choose to smoke or drink. If you choose to chew tobacco, well, then that puts you at equal risk. So it's just who's got the ability to take on those habits. Now with human papillomavirus, for reasons we're not quite certain, men are most at risk, and that's very different than cervical cancer. So this is an epidemic, and it's affecting men.
We talked before the program got started. Vermont has a history with vaccines, but there's a specific position that you guys take as medical professionals related to the HPV vaccine, and I'm going to ask you to open that up and get into a little bit.
And this has finally been supported by the American Academy of Pediatrics and also the CDC, but they're recommending vaccinating not only young girls, 13 and younger, but also young boys.
And even though the boys tend to get the head and neck cancer, the girls the cervical cancer, it's the same type of human papillomavirus, the same strain of the virus. So these vaccination that we can do now should be effective for both.
Let me pick up on the piece about what I think is marketed as smokeless tobacco, the chewing tobacco. That's a fairly new realm. In other words, you walk into the store, the amount of products behind the counter they're tenfold what they were 20 years ago. So I don't know that smoking is going down, but I guess what I'm wondering is, are smokeless or chewing rates going up, and what are you guys seeing?
Well, Will, smoking is going down. Fortunately, the prevalence in the United States has been reduced. But if you want to do the perfect experiment to get cancer, put known carcinogens directly on a surface that's very susceptible and see what happens. And if you see a white plaque or irregularities in that area, you're in trouble. So, you know, we're very interested in making sure people know that this is a very dangerous habit that you might choose to pick up.
The only difference is that you'll get your cancer on your lip or on your gum rather than down in your voice box.
How common are these cancers?
We think they're very common because we see them all the time, but it's about 3% of all malignancies in the United States.
And traditionally, the head and neck cancers were seen in the older population, but that's because it takes a long time to get a significant smoking and drinking exposure. With the HPV-related cancers, we're now seeing them in younger people as well.
What about warning signs? You talked about the mouth, but what about other parts of the head and neck? Warning signs, symptoms, causing someone to take action to go see a doctor?
I think it's important to know that if you have a lump in your neck that doesn't go away, don't be concerned, but be sure you get medical treatment for it. I see a lot of patients that have all different reasons for it, but you need to understand why you might have a lump in your neck. If you have a white spot in your mouth, if you have a sore throat, if you have hoarseness, if you have ear pain and people don't know why, these are all signs and symptoms. If your dentures don't fit, if you have bloody sputum, saliva that is got blood-tinged aspects to it, these are all things that you must seek treatment for. There's different reasons for it, but these are signs and symptoms of head and neck cancer.
And of course, people can get a sore throat during the winter in Vermont, just like anywhere else. But if the sore throat just won't go away, or if the lump just won't go away after a reasonable amount of time, then even if it seems like a normal sign or symptom, you need to get it checked out.
One of the things that was interesting for me in researching and preparing for the program was I came across that denture piece a couple of times. And I guess it made me wonder, or have an opportunity to ask you guys, that there may be some minor discomfort or something and people with dentures aren't taking action. That's a very clear warning sign, correct?
Well, I think so, and it can be just merely that the denture doesn't fit, but get it checked out. You know, if we catch these problems early, there's so much more we can do about them. So absolutely seek medical attention if your denture doesn't fit, if there's a sore, if your tongue has a lesion. All these things are indications that you need to seek the care of your doctor.
We work very closely with the dentists and the oral surgeons in the area, and a lot of times they may spot something and then refer the patient to Marion or one of her colleagues for a biopsy or for a more careful check.
Dr. Couch, tell us a little bit about making a diagnosis.
So we'll take a careful history and make sure that we understand your risk factors. And that guides us into what we might decide to do. Then we'll do an exam. If you do this all day, every day, you get rather good at understanding what's worrisome and what's not. In the office, we now have the ability to do an ultrasound right on the spot. We can do a biopsy right on the spot. We can order imaging, which can be CT, MRI, or further ultrasound. We can do PET scanning. There's all sorts of things we can do. We can then schedule you for surgery if we think it's going to be uncomfortable and do an endoscopy under anesthesia. And then if we have any concerns, why, we send you next door to our friends, and we have a full team of experts that can treat you.
And Steve, let me turn over here because we're seeing a slide at the very top. We can come back to surgery, Marion, but talk a little bit about that first piece there, organ preservation.
Well, actually, the most traditional treatment for these cancers is surgery, and we will be coming back to Marion on that. But there's an entire field within oncology of organ preservation treatment. And I think head and neck cancer and some of the sarcomas are really where this started, where we tried to get a good response, a good treatment, a cure even, but without having to sacrifice the organs or the function of the organs. And we found in areas where we used to have to use surgery, by using radiation, often with just a little bit of chemotherapy to make the radiation stronger, we can get an excellent response, and with much less side effects in the short term and in the long term as well.
I don't want to dwell on it, but there will be side effects.
We could not tell you that there are not going to be side effects, but another area that we work on is symptom management. And some of the side effects that people fear the most, such as nausea and vomiting from chemotherapy, it's 90% less than it used to be, because we're making advances in those areas all the time. I work with a lot of people who work in the area of mucositis, soreness within the mouth, and there's a lot of research going on into why that happens and how to stop it. So we're cutting down on those side effects even as we improve the treatments.
And Dr. Couch, again, as the surgeon, your field has made incredible advances as well.
We have. And we've always wanted to. You know, as a surgeon, you don't feel good about removing large parts of somebody's face and affecting their ability to interact publicly or swallow, speak, breathe. So we've always been interested in that. So now we have ways where we can take very specific margins around the tumor and prove that we've gotten just the cancer out, leaving the normal healthy tissue behind. We have greatly improved ways of reconstructing the area. We can borrow a piece of bone in your leg to rebuild a mouth. We can borrow a piece of bone from your hip to rebuild the jaw. There's certain things we can do to really make you have the ability to return to a more normal life. And we're very proud of this. If, as a team during an oncology conference, you know, as a surgeon, I always like to operate. But if as a team we decide that it's better for that patient to not undergo an operation and to have organ preservation at the University of Vermont, as in most academic medical centers, we're very interested in having that happen. We follow clinical trial protocols. We make sure that it's a multidisciplinary team that comes up with a treatment plan. And again, we're happy to step aside. We're happy to take on the responsibility of operating, depending on what the multidisciplinary care team decides.
Many of our patients are first seen in the ear, nose, and throat multidisciplinary clinic, where the surgeons, the medical oncologists, the radiation oncologists actually see the patients together. So you don't have to make multiple trips to the hospital. You make one trip to this clinic, we look over the case, we decide which of the modalities is going to be needed for treatment, and we can get a joint decision made right then and there.
Let me take just a moment, and because this is really an opportunity, and I don't mean it as a crass plug, but folks are seeing the Vermont Cancer Center. You guys are both members of that, and that's in part what the Cancer Center is doing, the comprehensive approach with research, education, and maybe just open that up a little bit. Tell us a little bit more about the Vermont Cancer Center.
So I think the ability to run clinical trials and have bench to bedside research is what we're all about. And we really emphasize that. If there's areas where we can take the findings from our basic scientists and try to do clinical trials to help us better understand what's going on in our patients, that's what we do. We sign up with large organizations across the country that are running trials so that we can participate in that. And we hope to really grow that aspect of what we're doing. I think that you will get better care in these types of situations if, because of reasons related to your support system and your family, you wish to get treatment close to home. We'll work with your clinicians nearby, but we offer full services. And going back to what Dr. Grunberg said, it does take a village. You've got to have someone that's going to help you with your swallowing. You've got to have someone that's going to help you with all different aspects of your care. The problem with head and neck cancer is when we treat one area, we may be affecting your ability to talk, breathe, swallow. There's so many different functions that this area does. So it's a huge team of providers and also support staff that intervene on the patient's behalf. And that's what the Cancer Center is really always trying to do.
And it does give us the opportunity to interact between the clinical side and the basic research that's available at the University of Vermont. We had an idea about a year ago that there were certain body chemicals that might have to do with whether people are going to get soreness in their mouth when they get radiation that might be detectable in saliva. We found that there was a laboratory actually over in the neurobiology section that was able to measure this chemical. And we were able to set up a study where we were able to take saliva samples on our patients, take them over to this laboratory, and learn more about the problem.
And Marion, as you were speaking, I honestly couldn't help but visualize the public service announcements that I've been on the air for maybe the past 6 months, a series of, that idea that smoking didn't just affect the lungs. There are the patients who are now talking with voice boxes, and there was an interview with one of those people recently who said, I've even forgot what my own voice sounded like.
Right. It's a very profound effect that not only the cancer, but the treatment can have. And you have to understand that. They may need psychological help. The supplies that they need to be carefully delivered. There's a lot you have to do. And people need to feel good about themselves as they're going through treatment. And one of the areas of research that I think both Steve and I are very excited about, asking the question, should you exercise during cancer treatment? What is the effect of cancer treatment upon your skeletal muscle and your lean body mass, your ability to function? These are all great questions, but they affect the way cancer patients feel. And I think a good comprehensive cancer center is looking at the patient in toto, and that's what we always aspire to do at the Vermont Cancer Center.
Right. We have some people who are looking at, as you said, the effect of exercise on the muscles itself. And then we have other very practical exercise programs for our cancer patients who are trying to recover. And all of these people work together.
In recap, very briefly, the last message we want to leave people: who's at increased risk for head and neck cancers?
Well, Right now, with the human papillomavirus story, what we call HPV, we all are. So that's why we really strongly recommend vaccinating people. And then the things you can avoid is smoking, chewing tobacco, and alcohol is synergistic. So those are the risk factors, if I could recap, that we all have to watch out for.
I want to thank you both. Very educational and informative. I appreciate you coming in and spending some time with us.
Thank you, Will.
Our pleasure.
That is our program for today. We know you have choices, so thanks for choosing us. I'm Will Michael, inviting you to join us back here each weekday afternoon for another visit Across the Fence. For a video copy of today's program, call toll-free 1-888-ATF-3430. Across the Fence is brought to you as a public service by University of Vermont Extension and WCAX-TV.